Hi friends, how are you? Welcome to my YouTube channel D&D Pathshala. In this video, we will see regarding the drug-induced blood disorders, or it can be also called as drug-induced hematological disorders. So let's get started with our video. So first of all, we will go to the definition. These drug-induced type of blood disorders or the hematological disorders, these are a very rare and a very adverse type of hematological events that which are associated with the drug therapy. And these can be affecting any type of the cells, like they may affect the RBCs, that is the red blood cells, or WBCs, that is white blood cells, and platelets. So these are the different types of affecting cells by these drug type of blood disorders or the drug induced type of blood disorders. So these also have another name that are called as the blood dyscrasiasis. So these are also called as the blood dyscrasiasis. Means why it is called as blood dyscrasiasis? So here that is also known as like abnormal conditions that which is caused in the blood, which are said as adverse effects, or the reactions also that which are not predictable, means they can't be predicted before that they may cause these type of reactions, and or any kind of type of direct type of drug pharmacological type of actions like a direct type of side effect also. So that's why these are called as the blood dyscrasiasis. And because of the modern pharmacotherapy like polypharmacy and wrong drugs, means wrong prescriptional drugs, means it may be involving the wrong patient or it may involve in the wrong drug also, and like irregular time interval or irregular gap between the drugs having serious type of side effects, like such type of drugs like warfarin type of drugs. So if the proper time interval or proper time gap is not maintained between such type of drugs, they may cause serious type of side effects. So such type of serious side effects, these type of hematological type of disorders may be caused. So this is the brief definition regarding the drug induced blood disorders. Mostly these drug-induced blood disorders may occur through two types of mechanisms, like through direct type of drug, means the causative type of drug directly, or through its active metabolite toxicity or an immune reaction, means within the body, or because of the drug such type of immune response or immune reaction is arised in our body, such type of immune reaction also. So through these type of mechanisms, that is through direct drug or metabolite toxicity that which is involved with the drug, or immune reaction, that is the second type of mechanism. And mostly the anti-neoplastics, that is the anti-cancer drugs, are mostly involved in causing such type of predictable type of hematological diseases. Idiosyncratic means it is an unusual means it is a not a normal type of reaction that which is caused by these type of the blood disorders. So idiosyncratic reaction type of blood disorders will be depending upon the conditions that which are caused, and also by the associated type of the drugs. So these are the idiosyncratic type of reactions, means they will be depending upon the conditions caused and also by the associated types of the drugs. And because of these drug induced hematological or blood disorders, it will be affecting the complete hemopoietic system or the complete coagulation system. Now coming to the epidemiology. So how the epidemiological rate regarding the drug induced blood disorders is being reported means, so most of the cases have been reported due to the drug treatment, and as I've said in the starting slide, these disorders are really very rare, and the incidence of such type of ADRs are found in common type of reactions, but serious type of rare type of reactions like these type of reactions are not detected. Means the studies have also detected like 10 to 15% of serious adverse reactions are reported, means because of the less reporting also we can't be able to know that these are the disorders that which can be caused through these type of the drugs also. So the FDA has also reported the misinterpretation of the events of some type of drug safety labeling changes. So for example, a type of reaction, that is thrombotic thrombocytopenic purpura reaction. So this TTP reaction was actually not seen within the clinical trials. With which drug? Ticlopidine drug. So ticlopidine is an antiplatelet drug. So this was found out by the FDA. But whereas when the US physicians have reported nearly around 100 cases in between 1992 year and 1997 year. So the FDA government have actually seen, means in the clinical trials it was not seen with the ticlopidine drug, but the FDA has seen, that is the US physicians have reported nearly 100 cases. And it will be also based upon the patient exposure like 2 to 4 millions and assumption of the event type of reporting rate of 10%, means exactly it is not known type of the rate. The known thing is that incidence of this clopidine associated TTP, that is the thrombocytopenic purpura reaction, it is actually a very high type of reaction, means it will be occurring in a incidence like one case will occur in a 2000 to 4000 patient ratio. So 1 is to 2000 or 1 is to 4000. So who are exposed to this ticlopidine drug, in that people, in like taking as a ratio of 2000 people or 4000 people, we will be getting one case. So it is that incidence regarding the thrombocytopenic purpura associated with the ticlopidine drug. And another main reason of such type of cause of this are less number of ADR reporting also. Like if the less number of ADRs are reported, then the detection of this drug induced blood disorders will be also not accurate. Like if the reporting is not there, then the detection can also be made in a vast type of manner. So if the reporting should be increased, so if the reporting is increased, then the detection will be also very great. Now coming to regarding the heparin reports and thrombocytopenic, means heparin and thrombocytopenia associated reports, these are actually reported very less, so that the proper reporting of such type of ADRs will be helpful in identifying such type of drug induced type of the disorders also. So the risk of getting such type of drug induced blood disorders or drug induced hematological disorders and their risk of death, this is also increasing along with the age. So regarding the above point, that is the heparin and thrombocytopenic purpura conditions or thrombocytopenia conditions, these are also very reported less. And these type of reactions like drug induced blood disorder type of reactions also, these are already actually associated with the morbidity and mortality type of reactions. Like aplastic anemia was also found as the leading cause of death, that which is followed by the thrombocytopenia and hemolytic anemia, agranulocytosis. So these are the associated type of conditions. Now coming to the types of the drug-induced blood disorders or drug-induced hematological disorders. Up to now we have discussed regarding the definition and epidemiological rate. Now we will discuss regarding the types of the drug-induced blood disorders or drug-induced hematological disorders. So regarding the drug-induced blood disorders or drug-induced hematological disorders, there are actually divided into drug-induced aplastic anemia, drug-induced agranulocytosis and drug-induced hemolytic anemia. So this drug-induced hemolytic anemia is also divided into two types, that is drug-induced immune-mediated hemolytic anemia and drug-induced oxidative hemolytic anemia. And coming to the other types are drug-induced megaloblastic anemia, drug-induced thrombocytopenia. So we will see the disorders of the blood. So this is the brief picture regarding the hematopoietic system. So first of all, through the multipotent stem cell, there are actually two types of cells. One is myeloid cell and lymphoid cell. So from this myeloid cell, these are again divided into four parts, that is proerythroblast, myeloblast, monoblast, megakaryoblast. So from proerythroblast, normoblast, reticulocytes and erythrocytes. So these are the erythrocytes, that which are RBCs, that is the red blood cells. Now coming to the myeloblast, so these are the promyelocytes, that is neutrophilic, basophilic, eosinophilic myelocytes. From these myelocytes, neutrophilic and basophilic and eosinophilic metamyelocytes will occur, and from that the neutrophils and basophils and eosinophils will also occur. Now coming to the monoblast. So monoblast is from the monoblast, promonoblast, and from promonoblast, monocyte. Now coming to the megakaryoblast, promegakaryocytes, megakaryocytes and platelets. So these are the final products. Now coming to the lymphoid cells. So these lymphoid cells are B lymphocytes, T lymphocytes. So erythrocytes are RBCs, neutrophils, basophils, eosinophils and monocytes and platelets. So these are the remaining cells that which are mostly seen in our body. Now coming to here, the differentiation of the stem cell is actually done into the committed type of cell line. So here we can see that is, so if the bone marrow in the myeloblast and metamyelocyte and the neutrophil are mostly involved, then it will lead to a granulocytosis condition. And here if in the stem cells, proerythroblast and late normoblast and red cell, that is the red blood cell, are involved, then hemolytic anemia. And coming to the thrombocytopenia, so thrombocytopenia means megakaryoblast, megakaryocyte and platelets. If these are involved, then this is the thrombocytopenia. So if these three conditions are actually combined, then this will lead to the aplastic anemia. Now coming to the drug-induced aplastic anemia. So this drug-induced aplastic is a very rare and a very serious type of disease with unclear type of etiology. It is also considered as the most serious type of drug-induced blood dyscrasiasis because of the associated high mortality rate as compared with the other type of blood dyscrasiasis. And also in this disease, the bone marrow and the hematopoietic stem cells are damaged. So it is one of the serious type of drug-induced blood dyscrasia and also having high mortality rate. So firstly, this was described by Ehrlich in 1888. So it was described by Ehrlich in 1888 as during an autopsy. Means during autopsy of a pregnant woman, this hemoptysis was identified in a failed condition. So by this first report, numerous cases of aplastic anemia were identified. And this will be occurring in 2 to 7 persons, like in a million number of inhabitants. And coming to its incidence, it is different in different type of regions and mostly in the environmental type of components also. So it will be as a etiology for such type of condition. Means it will be differing in the different type of regions. So because of the hemoptysis failed in the autopsy of a pregnant woman, from that first report, numerous cases were also identified and in 2 to 7 persons in a million number of inhabitants. And as by all the studies, the results they have stated, in the younger, means lesser than 30 years and elder people who are having a greater than 60 years, they are having the similar type of increased risk of aplastic anemia. And these can be actually divided into 2 types. One is inherited and another one is acquired. So mostly inherited type of aplastic anemia, it is mistaken with acquired. But inherited type of bone failures can be seen in the first decade of life, like the physical abnormalities like short stature and etc. type of features. These will be actually rarely responding to the immunosuppressive therapies. Whereas when coming to the acquired cases, so these are of the most type of the causes that which are caused by the external factors and also the autoimmune type of factors and by the genetic factors. So these are the inherited type of cases and acquired type of cases. Means acquired is by external factors only, not, but also with the autoimmune factors, genetic factors. Inherited means they will be rarely responding to the immunosuppressive therapy. So majority of the cases, means 25 to 40% of the cases with the external factors like drugs, insecticides, benzene, radiation and by the viruses like hepatitis A, such type of factors are mostly involved. And others like chemical exposures also. And by the external factors, these will be also acting as a risk factors also. So majority of the cases means these will not have a definitive or a proper type of cause. So these are the reactions and these are the effects and these are the external factors that which may cause the aplastic anemia, that to drug-induced aplastic anemia. So here the majority of the cases will be sometimes also not having a definitive or a proper type of, means idiopathic conditions. So here we can see the drugs that which are associated with the aplastic anemia. So what are these observational study evidence and case report evidence means? So by the observational study evidence means it can be observed with a study type of evidence. So here with the case report evidence means by the reporting, like by the ADR report cases. So observational study evidence means like carbamazepine, furosemide, gold salts, NSAIDs, phenytoin, phenothiazines, sulfonamides. And by the case report evidence means like example acetazolamide, aspirin, captopril, lithium, lisinopril, quinidine, cilinidac, ticlopidine, dapsone, felbamate, interferon alpha, chloroquine. So these are the some of the drugs that which are actually causing the associated type of aplastic anemia. Now coming to its pathophysiology means the pathophysiology is actually caused due to the damage in the pluripotent stem cell, means even before they convert into the committed type of stem cells, means which should be transferred into which type of form. So these are actually caused, means this drug induced aplastic anemia is caused due to the damage in the starting stage, means to the pluripotent stem cell. So it will be affecting mostly the red blood cells, RBCs, neutrophils and platelets. And mostly this drug-induced aplastic anemia's pathophysiology will be caused through three types of main mechanisms by damaging these pluripotent stem cells. So one is direct dose dependent drug toxicity, and second is idiosyncratic mechanisms, and third is the drug or the metabolite induced immune mediated aplastic anemia. So we will see in the depth. So drug induced aplastic anemia through the first mechanism, that is the direct dose dependent drug toxicity. So it is leading to the transient type of marrow failure, means here the transient type of marrow failure occur. So because of such type of failure, the secondary to direct suppression may occur because of this direct suppression of the proliferating type of cell systems. So as I have said, in the pluripotent stem cells will get suppressed. So these will be mostly affected by the direct suppression of these cell systems. And then the hematopoietic suppression means the complete blood system, that which will be mostly involving RBCs, neutrophils, platelets, will be continue with the dose increase, or either it may dose increase may be either suddenly or rapid type of increase also. So this direct dose dependent drug toxicity will be mostly caused through the chemotherapy and radiotherapy also. So whereas when coming here, so mostly caused through the chemotherapy and radiotherapy, idiosyncratic mechanisms toxicity will be mostly occurred because of the toxic metabolites of the parent drug, and also by the altered type of variations in the pharmacokinetics of the suspected drug and genetic polymorphisms, like if the changes that which may occur due to the metabolism that which lead to the hypersensitivity reactions of the stem cells. So because of the genetic polymorphism, means the genetical changes in the metabolism, it will lead to hypersensitivity reactions. Hypersensitivity reactions will be leading in the stem cells, and then they will lead to the destructive effects. These destructive effects will be caused by the drug. Now coming to the drug or the metabolite induced immune mediated aplastic anemia. So most leading and common type of mechanism that which cause this aplastic anemia is through this type of cause. So it is actually described as the exposure of the specific type of drug or antigen that which leads to the activation of the cells and cytokines of the immune system. So because of such type of exposure of this such type of drugs or antigens, activation of cells will occur, and activation of cells and activation of cytokines will occur. This will lead to the stem cell death. Mostly, as I have said in the starting slide, anti-neoplastic agents will be mostly causing such type of dose dependent reactions. So they can be suppressing the cells in a reversible type of manner, not in an irreversible type of manner. And also the degree of the suppression and the cell line that which will be involved. So these will be involved and depending upon the nature of the drug, and also in the ability of it to inhibit, and also the marrow proliferation like chloramphenicol, and also causing the marrow type of depression. So the degree of suppression and the cell line will be depending upon the nature of drug and its ability. So for example, here the chloramphenicol will be causing the most marrow depression, that which is the dose dependent and reversible. Coming here, the chloramphenicol induced type of reactions will be also involved in the idiosyncratic type of mechanisms. So in the idiosyncratic type of the mechanisms means, so it is mostly caused because of the nitroso group. So idiosyncratic type of mechanism is different and dose dependent are different. So this will be mostly involved in idiosyncratic type of mechanism. But dose dependent and idiosyncratic are different, and it is mostly caused because of the nitroso group and formed from the reduction. So this is some of the chemistry type of thing, like nitroso group is formed by the reduction of nitrobenzene ring of the chloramphenicol. So from chloramphenicol, nitrobenzene ring is reduction, that which is formed from the nitroso group. So formed from the reduction of nitrobenzene ring. So it is causing because of this nitroso group. So because of the chloramphenicol resulting, it will be interacting with the DNA of the stem cell, cause damage. So because of such type of DNA of the stem cell damage interaction, the damage to the chromosome will occur. The damage to the chromosome will lead to the cell death. And estimated type of incidence through getting through the chloramphenicol means chloramphenicol induced aplastic anemia is 1:20,000, means 1 in 20,000 patients will be getting this type of drug-induced aplastic, that is chloramphenicol-induced aplastic anemia, and they will be treated, and it is now very decreased because of its reduced use. And other drugs that which may cause aplastic anemia through toxic type of metabolites are like phenytoin, carbamazepine, and such type of drugs. Now coming to the signs and symptoms. So symptoms will be appearing within days, 2 months after taking such type of particular drug. So by this particular type of drug, on average of 6.5 weeks, or even appear after discontinuing of the drug also, the clinical features will be depending upon the degree to which each type of cell line is suppressed or similar to the idiopathic type of disease. Now coming to the neutropenia is also a sign, and it is also a type of symptom. So signs like low levels of neutrophils can be seen. Pancytopenia. So what is this pancytopenia means? Here they will be having the deficiency of all the types of blood cells, like it will be including red blood cell, platelets, white blood cells. So this is the pancytopenia condition. Here you can see the difference between a normal blood cells and pancytopenia condition. So such type of pancytopenia. Here thrombocytopenia to the platelets, and leukopenia will be occurred to the WBCs. Anemia means as the RBC's lifespan is long, so it occurs lately, means anemia will be the last condition to occur in pancytopenia. And other types of signs and symptoms like fever, fatigue, chills, weakness and pallor, bleeding, and high probability of infection. Such type of signs and symptoms can be seen in a drug-induced aplastic anemia patient. So this is the pancytopenia diagram. And coming to its diagnosis, the WBC count, if it is of 3500 cells per mm cube, or if it is less than that, and if a platelet count is less than or equal to 55,000 cells, and if the hemoglobin value is of 10 grams or less than 10 grams with a reticulocyte, means with a less reticulocyte count of 30,000 cells equal or less than 30,000 cells. So these are some of the diagnostic type of tests. And once this is diagnosed, acquired aplastic anemia can be actually classified as non-severe, severe, or very severe based upon the degree of the bone marrow cellularity, and also be depending upon the peripheral neutrophil counts and platelet counts and reticulocyte counts. So it will be discovered, or it will be classified as a non-severe aplastic anemia, or severe or very severe, such type. So the severe aplastic anemia is mostly defined as it will be having at least two of the following type of three peripheral blood findings, like neutrophil count will be less than or equal to 500 cells, platelet count will be less than or equal to 20,000 cells, anemia will be also there, like with a corrected type of reticulocyte index of less than or equal to 1%. So such type of diagnostic conditions can be seen within a severe aplastic anemia. Now coming to the prognosis, if the prognosis is poor, then it can be said as it will be mostly due to the neutrophil count, like as it may decrease or less than or equal to 200 cells. So which in this type of definition, it is a very severe condition also. So here a bone marrow aspiration and a bone marrow biopsy can also be required, are also required to exclude other causes of pancytopenia, so that it can be ruled out. Now coming to the treatment, this disease can be stable in some kind of people, and it is also even becoming severe to very severe condition also. So stable people can be managed, but if this is in a severe or very severe condition, then the treatment should be given appropriately. And the first type of treatment is early withdrawal of such type of causative drug should be done. So by the early withdrawal of such type of causing drug, then the drug-induced reactions will be decreased to some extent. Now coming here to the supportive care, like prevention of moderate or serious type of bacterial and fungal infections, and use of the prophylactic type of broad spectrum antibiotics, and also transfusions of the RBCs, platelet supplementation, and the prophylactic antibiotics and antifungals are recommended in the case of neutrophils are less than or equal to 200 cells. Otherwise, unnecessarily the prophylactic antibiotics and antifungal drugs shouldn't be given. And the treatment should be also given according to the degree of the cytopenias, like major type of treatment options or allogenic type of. So the major type of treatment options are allogenic and hematopoietic type of stem cells. So major treatment options are allogenic hematopoietic stem cell transplantation. So allogenic hematopoietic stem cell transplantation, that is HSCT, and immunosuppressive therapy. So most of the patients will be mostly cured through this HSCT technique, and reports of 77% in adults and 80 to 90% of children are there. Means by the curative ratio is about 77 in adults and 80 to 90% in children. But the major disadvantage is that is the less eligibility will be there. Means only 30% of the people will be finding a matched sibling donor. And for some kind of cases like no matched sibling type of donors, like the options will be like mismatched, related, matched but unrelated. So such type of options will be there, but they may be less effective when compared with the matched sibling donor cases. Now coming here, the complications like graft rejections. So graft rejections and graft versus host disease, such type of complications may also occur. And immunosuppressive therapies like combination of ATGs. So ATG is known as the anti-thymocyte globulin, and cyclosporin. It is also a immunosuppressive drug, that is it will be inhibiting the inhibition of the T lymphocyte type of condition. So it is one of the most important drug in immunosuppressant. ATG is actually, this ATG means that is the anti-thymocyte globulin is mostly derived from the animals like horses or rabbits. But when compared with the horses and rabbits, mostly rabbit derived anti-thymocyte globulin is effective when compared with the horse derived. So this ATG is consisting of polyclonal immunoglobulin G. So that which is actually directed against the T cells. This cyclosporin will be also acting against the T cells. But this ATG is having the polyclonal immunoglobulin G, IgG, that which is directed against T cells. So around the dose of ATG will be around like 40 mg per kg per day for 4 days. So it is given in such type of dose. And the dose of ATG is, as I've said, 40 mg per kg per day for 4 days. And cyclosporin. So the cyclosporin is inhibiting, the mechanism is, it is inhibiting the interleukin 2 production. The IL-2 production is inhibited and the release, and by the subsequent activation of the resting T cells will be also inhibited. So that is the mechanism of the cyclosporin. So the dose is about 5 mg per kg per day in 2 divided doses, and the cyclosporin dosing will be varied like 4 to 6 mg per kg per day to 10 to 12 mg per kg per day. So these are the doses. And by addition of the cyclosporin to ATG, the response rate will be increased, the survival rate will be increased, and the treatment efficiency will be increased, and also the failure rate will be also decreased. And other type of drugs like corticosteroids are also used to prevent ADRs of the ATGs, it is the anti-thymocyte globulin. Like the corticosteroids that which are used like prednisolone for about 2 to 4 weeks in a dose of 1 mg per kg per day. So this is the drug-induced aplastic anemia brief view regarding the causes, patho, and the signs and symptoms, and regarding the diagnosis, and also regarding the treatment. In the next video, we will see regarding the drug-induced, immune-mediated type of reactions and other reactions. So that's it for this video. If you like my video, like, share, subscribe, and comment to my videos. If you have any doubts and if you have any kind of queries, and comment me to every video so that I will be seeing your comments and I will be answering them. But Please comment and please share my channel and subscribe to my channel so that I'll be enthusiastic to post more type of informative videos. And thank you.